Okay, I'm introducing Dr. Mel Derry now. Dr. Mel Derry is a GP here in Canberra, and she's going to talk to us about her clinical practice. First of all, do we need to find you a chair to sit on?
Well,
what would you like to do?
I'm worried about being too short. Oh no, that looks good. That looks good. Okay, great. All right, thanks, guys. Okay, perfect. Well, I just want to say first, thanks, Liz and Tracy. You guys are doing an awesome job, and I think this is a great conference. So I'm a GP and I have an interest in low carb medicine. My husband and I run 3 general practices in Canberra. Your GP at Crace, Lyneham and Denman, and I'm currently working from our Denman practice. I'm going to talk about some of my approach to low carb medicine, and that'll include an approach to type 2 diabetes and also an approach to kids. So for some background, I've always been interested in the science of weight loss, both out of a personal interest and for the benefit of my patients. I come from a family where there is a lot of obesity. I went on my first diet at age 15 and very successfully lost weight, but then developed an eating disorder because it was completely unsustainable. It took many years to heal from that experience. And one of the vivid memories I have of that time was the terrible preoccupation with food and the feeling that my body was my enemy, and just having to fight against constant hunger. So I wanted to find a way of losing weight that was sustainable, that was healthy, that was gentle, and that worked with my body and not against it. And we didn't have that constant hunger battle. So for me, finding that solution has been like the holy grail of medicine, because obesity is linked with so many chronic health conditions. So at medical school, and the 20 years since that I've been a doctor, I've always paid really close attention to discussions around weight loss, to new treatments on the horizon, new types of diets, weight loss surgery, and medications. And as doctors, we're expected to try and encourage people to lose weight if they're above a healthy weight. But I was really frustrated with the tools in my toolbox to help people. Diets and pills generally only gave short-term benefits, and then, as we've heard, led to long-term weight gain and a slowing of the metabolic process. The only method that seemed to really cause a dramatic weight change was bariatric surgery. But even with this, you can cheat, and people do tend to put weight back on over time. So there are lots of factors that influence whether someone will be susceptible to putting on weight besides, their carb intake. The old calories in, calories out thing doesn't take into account our individual hormones, metabolism, and genetics. And one really important factor is our natural desire to eat and the signal to your brain that you've had enough to eat. Both of these are very hormonally driven. And I like to think of people in terms of their natural interest in food, their appetite and their metabolism as a little bit like being different breeds of dog. So some people are like greyhounds. Is it greyhound on the screen? Yep. Yep, cool. So I have never seen an overweight greyhound or whippet. They have genetics to be lean. They love to run. They burn off what they eat. But some people, myself included, are a little bit more like Labradors. We love our food and don't necessarily have the hormonal response when eating to stop soon enough. And this is compounded by not having the metabolism to burn it off. So I have had a Labrador before, and he was extremely food focused, and he would eat anything in front of him at great speed, and sometimes I was actually worried he would choke. And now I have a poodle cross, and we will feed him, and he'll just leave food in his bowl all day, and he'll just go and graze on it through the day. He's not a food focused dog. So our individual appetite and focus on food is very strongly genetic and hormonal. Now I say this to take some of the blame and shame out of weight gain. It drives me crazy when people who are naturally like greyhounds can have a judgmental attitude to people who are naturally like Labradors and think that weight loss should be easy. And I have a lot of empathy with people who are struggling with their weight. So I came to embrace low carb in 2017 by listening to the experiences of my patients. I was seeing a very senior nurse as a patient for a couple of years, and she had some chronic health conditions, and she came in to see me one day and said that she had tried low carb, she had lost 20 kilos, and she was feeling great. And I thought, well, that's really interesting, and I mentally filed that away. Then I saw another patient who had a really high cholesterol, whose choice it was not to go on statin, and she wanted to go on the keto diet. So she came and told me this, and she wanted me to check her bloods, asked me to monitor her just to check that keto was safe for her. She lost a few kilos, but she said within 3 days her fibromyalgia pain was gone. And I thought, well, that's really interesting, and I filed that information away. And then she started sending me some videos from low carb talks and asked me what I thought. So the second video was on managing type 2 diabetes with a low carb approach by Dr. Eric Westman. And it was like a light bulb came on for me. He was a person of science who was speaking my language and introducing me to a whole new way of thinking. It made sense and it worked. I had a eureka moment. I was absolutely hooked, and I binge watched everything I could on Diet Doctor and then everything else I could find, and it was a real focus of learning for me for several months. The remarkable thing for me about keto is that it suppresses that rebound hunger, which gave me hope that we could have a sustainable weight loss strategy. And it didn't feel like a fight against your body, plus the amazing added benefits of lower insulin and lower blood sugars and better health outcomes. So I started it. And I have to say, when I first started it, and my husband, who is also a GP, saw me eating cream cheese pancakes with butter and double cream on top, he raised his eyebrows. And I just said to him, dude, back away. Don't say anything, just let me do this, okay? And he did, to his credit, and it worked. You know, I lost some weight, I felt better, and that was fabulous. So then I wanted to try it with my patients, but it felt like a big step because it was going against mainstream thinking. The first patient I tried it with was a beautiful lady in her 60s who had long-term type 2 diabetes that was poorly controlled. She was also under the care of an endocrinologist. And she regularly had HbA1c high 8s, low 9s, which is not well controlled. And she would come in for her appointments looking defeated. She had a slouch in her shoulders, and she would come in and she'd shrug and she'd say, what else can I do? She wanted to do better, but she didn't know how. So one day after I learned about low carb, she came in with a HbA1c of 9.2. And I thought, this is so frustrating. We have to try something different. So I told her about this new approach to managing diabetes, and she was willing to give it a go. So on the day that she started, we cut down her insulin by half, and her sugars dropped, her weight dropped, she felt better. We were gradually able to completely stop the insulin. And she, in 3 months, HbA1c went from 9.2 to 6.8. And I have never been so excited about a blood result in my life. Over a year or two, she lost 20 kilos and she's kept that off. And now when she comes into appointments, she is excited about knowing her results. She's proud, she feels successful, she feels in control. And she and her husband are loving the food. So since then, I've had the opportunity to suggest low carb as therapy for a variety of health conditions, such as obviously for weight loss, diabetes, but also gastroesophageal reflux disease, polycystic ovarian syndrome, chronic fatigue, fibromyalgia, and arthritis. Now, I'd just like to say a few words about medications for type 2 diabetes. I mentally divide them into the good guys and the bad guys. The good guys indirectly cause a lowering of the insulin levels through a variety of different methods. And because of this, because of lower insulin levels, they are associated with weight loss, with a low risk of hypoglycemia and fewer heart attacks. The first one we usually use is metformin, which is a hero drug that stops you releasing sugar stored in your liver into your bloodstream. And it also makes your insulin more effective, so you produce less of it. And there are several other types of good guy diabetes medications. Then there are the bad guys. These may cause better sugar control, but they do so by increasing your levels of insulin. And because of high insulin, the bad guys cause weight gain, a risk of hypoglycemia, and no reduction in heart attack risk. And one commonly used of these is the sulfonylureas, which would usually be glycoside, and it might be known as dimicron. And it's favoured by some doctors. It's an old doctor, doctors might be familiar with it. It's also off patent, so it's cheap. But if you're on this medication, I just suggest having a chat to your doctor about whether you can change to one of the newer generation diabetes medications. The other bad guy for type 2 diabetics is insulin. Insulin is, of course, life-saving for people with type 1, but I try and avoid it where possible with type 2. It is sometimes necessary in really advanced type 2 diabetes with pancreases failing. And if we need to use it, we absolutely need to use it. But by combining it with low carb, we can get the minimum amounts of insulin. So one of the other things I wanted to share was some tips on your relationship with your doctor, whether that's your GP or your specialist. I do hear of people who are scared to tell their doctor that they're doing low carb, as they fear being chastised, or maybe they have been chastised. I certainly have had some new patients tell me that they're doing low carb, and they tell me so tentatively, and they look so relieved when I say, you know, I'm all for that. If you are continuing to see a doctor, it is important to tell them that you're doing low carb, and this is for two reasons. Number one, you might be the person that convinces them that low carb is something they should look into, that maybe they'll become a low carb advocate. What was effective for me about patients who shared their story was that they weren't trying to directly convince me, they were sharing their experience, which is a powerful testimony. The second is that they may need to be aware that you're doing low carb to give you the safest care. So an example of this is in type 2 diabetes. A very popular medication is the SGLT2 inhibitors. It's one of the good guys. These medications are fantastic for diabetes because they let your body pass excess sugar from your blood into your urine. So this causes a loss of calories, which helps with weight loss and also lowers your blood sugars safely, and that can lead to a lower insulin response. They're highly favoured at the moment because they have great evidence for reducing the risk of heart attack and heart failure. But if you're fasting, unwell, or you're doing low carb, you have an increased risk of having a rare side effect called euglycemic diabetic ketoacidosis. Ketoacidosis is usually something that only type 1 diabetics get. It's a very dangerous condition that could lead you to be severely ill and intensive care. You can also get ketoacidosis with SGLT2s without being low carb, but low carb increases the risk. So it's something to discuss with your doctor. While at the moment there is just a small number of doctors who are recommending low carb, I feel awareness is growing and the numbers are increasing. So on GP Facebook groups now, I regularly see people talking about their success with low carb, and obviously there are some heated discussions about this, but it's on the agenda and people are being exposed to new ideas. So in our group of practices, your GP, we have 22 GPs, and I've presented on low carb at practice meetings, and I didn't have any pushback. They were really interested and receptive. I teach medical students and GPs in training, and they always get an earful about low carb and keto. And in fact, I gave some teaching to a GP training just this week, and she was really interested and she's going to give keto a go. So I'm hoping that things will keep changing in that area. One other tip is if you are struggling with your weight, ask your GP if you are on any medications that could make it difficult for you to lose weight or might make you be putting on weight. I sometimes find when I see a new patient, we take a bit of a weight gain history. I can often see that it started or some increased weight happened when they started a particular medication, and that they were not aware that this medication had the possible side effect of weight gain. And finally, I wanted to share some tips about children. Now, many kids love what I call the white diet. Plain food, little variety, easily consumed, low nutritional value, mainly carbs. So this would be white bread, milk, pasta, potatoes, cereal, chicken, preferably in the form of chicken nuggets. Cauliflower is definitely not on the child-approved white diet list. The only exception to the white diet list is tomato sauce. Tomato sauce is very popular with the kids. So my children would happily live on plain pasta, cereal and toast. So they come home from school famished. They might eat 3 bowls of cereal. Then around 5 p.m. they get peckish again and they would naturally go for some more cereal or toast. And then when they get to dinner, they're not hungry. Now, I think for most kids, dinner is the most nutritious meal of the day if it has a good supply of protein and veggies. And I think this is a really typical pattern amongst kids when I'm discussing this issue with my patients. So how I manage this with my kids, and my kids don't have diabetes, they are healthy, growing and active. I don't actually limit their carbs, but we do have no honey, jam or Nutella in the house. I only give one type of cereal in the house that does not change, occasionally 2, because I do want them to be bored of cereal. and they complain about the lack of variety, but it's very deliberate. And I stop the meeting before dinner. And I try and encourage them to eat something with protein in the afternoon tea, like an omelette or chicken tenders. We normally have a low-carb dinner, and they don't even realise because it's delicious. If there is a side of carbs, I tell them that if they're not hungry, they don't have to eat the carbs. But obviously, the carbs is what they want to go for first, usually. I think it's really important as parents that one of our most important responsibilities is to get kids to adulthood at a healthy weight, knowing good food choices and being physically active. If they get to early adulthood overweight, then they are going to put on a greater amount of weight during their adulthood than someone who's not overweight. So the problem just keeps getting worse. There have been studies of parents of obese and overweight children, and they found that over 90% of these parents did not even realise that their child was overweight. And if they don't realise the problem, they can't even start fixing the problem. So even if parents can see on objective measures that their child is overweight or obese, they often won't accept it. And one of the reasons for this is that there are so many children now who are overweight that it's become normalised. And the second is that our children are our absolute darlings who we love, and we have a complete blind spot to it. So when my own children, I've got 3 children, and 2 of them have previously been in the overweight range. They're now not. But even when I looked at the objective measures and I could see that they had just gotten into the overweight range, I couldn't see it with my own eyes. You know, being aware of these studies, I was just looking at my children and thinking, well, they look pretty perfect to me. But later on when they slimmed down, I could see, looking back at photos, that they were carrying some extra weight. So, so how can we objectively measure if a child is overweight? It can be really helpful to look at the child BMI charts. Now, BMI isn't always accurate in adults because, you know, someone might be an athlete or a bodybuilder, but it is usually more accurate with kids. Now, the exception is very athletic teens. I did put my 12-year-old boy through this measure, and it said that he was overweight, but he's absolutely ripped, and people ask him if he's on steroids. So it doesn't always work. But the important difference with kids' BMI is that the healthy BMI range changes with age. So you need to look at an age-specific graph. So you can find one in your blue book, but no one ever seems to use them. Or you can find one at a website like this one. This is my favourite website to use. So I'm going to show you what you do when you click on this website. So you find this page. Now what you need to do first is go up to the top right, and it will automatically be English, and you change it to metric. And then you put in your child's details. I put in my youngest son, and then you hit calculate at the bottom. So the next page you'll get is this page. So it says that my son is, his BMI is 17.7, which is on the 67th percentile. This child is a healthy weight. So between 5 and 85th percentile is a healthy weight, and over that 85th to 95th is overweight, and over 95th is in the obese range. Now if you click on the bottom right BMI for age percentile growth chart, then we'll get to this page, which I think is the most helpful page. And you can see really graphically how the BMI changes with age. So you can see that BMIs are lowest when the kids are around age 4 or 5. And if there was a 5-year-old who had a BMI of 22, which would be a very healthy adult BMI, they would be very obese. So one of the things I find really helpful about this chart is that you can track things over time. So if you have a child, say, who has a BMI of 96th centile, you know, maybe in 6 months you could do it again, and it might have moved to, you know, the 93rd centile, and you can see that you're making improvements over time. So I do find that talking about weight with parents and kids is very delicate, and I always do it in a really careful way to make sure the child doesn't feel labelled as fat. Often I ask the kids if I could measure them, and we'll see how well they're growing and how big they're getting, and the kids are usually really enthusiastic about that. And I'm very careful to talk about, you know, if the child does have to stay in the room while we talk about this, you know, the term over a healthy weight rather than fat, overweight or obese. And I finally have some shopping tips if you're new to low carb. First of all, if you're in the supermarket, don't go up and down the aisles. Usually most of the things that you're going to need are on the periphery of the supermarket, so the eggs, dairy, meat and veg. If I find myself wandering down an aisle, I stop myself and check, what are you going down here for? If it's for things like macadamias, olive oil, tins of fish, then that's okay. Try not to eat processed food, and that includes, I would say, low carb processed food. I would try and keep that as a treat. I actually mentally divide most low carb processed food into two categories. So there is one category that is expensive, truly low carb, and most of it tastes awful, with the exception of products like Behind. But there are some very, very unappealing low carb products on the supermarket shelf. And the second type of low carb products are products that taste really good and they are not actually low carb. So just take real care with low carb foods that are full of sugar alcohols like maltitol or sorbitol. They're actually really high in carbs and will raise your blood sugar and your insulin, and it's terribly false marketing. And I've wasted a lot of money purchasing low carb products that I've put in the bin because they are disgusting. So I think it'd be a really great tip, you know, if you're wanting to try some low carb foods, to ask this community what they like, because there are some great low carb products. So food and drinks with sweeteners, even if they are not low carb, like a diet soft drink, will cause an insulin response. And this is because your body starts producing insulin in anticipation of the sugar hitting the bloodstream. So when you taste that sweetness, your body will start responding with some insulin. And an insulin response can slow down or turn off ketosis and slow your weight loss. So as with everything, some people are going to be more sensitive to that than others. But if you're having a stall, maybe try cutting out artificial sweeteners and see if that helps. Now, there was a question. Should I answer that now, Liz? Yeah. Okay, so there's a question about statins and being diabetic. And if you ask different low carb doctors, they would probably have different answers. So be interested in what Liz's answer is to this. There are lots of medications that lower your cholesterol, but they don't actually lower your risk of having a heart attack or a stroke, which is really our end goal here. So statins, I believe, do lower your risk of having a heart attack or a stroke, but I don't think the mechanism is through lowering your cholesterol. I think it's probably another mechanism. I do believe that it does lower your risk of having a heart attack or a stroke, and I think the measure might be in the order of about 30%. So for most people who are doing low carb, they've got great triglycerides, good HDL, even if they've got really high LDL, I'm happy for them not to be on a statin. An exception for this for me would be people who have previously had a heart attack. Those guys are at the highest risk of having another heart attack. So I do think that being on a statin is valuable. And there is a kind of, I don't know, it's kind of arbitrary measure in some ways, but if you've got diabetes, type 2 diabetes, and you're over 60, you are considered at about the same high risk as someone who has previously had a heart attack. There's a really high risk of having a heart attack. So I would be encouraging people to be on a statin if they're in that category. It will cause a slight rise in HbA1c that I've seen for some people. I personally think the trade-off is probably overall beneficial. You know, and I think, yeah, so that's my take on it. Liz, did you have a separate response to that?
Thanks, Mel. So the question was something to do about de-prescribing statins in people with type 2 diabetes. And I guess if you're reversing the diabetes and your HDL is good and your triglycerides are low, I would be all for a trial of getting people off statins. I agree with what Mel said, that there is modest evidence that statins can reduce mortality, but we have a lot of doubt as to the mechanism of that. It probably is not about lowering cholesterol. I certainly see a lot of people come in on statins because their GP or some other doctor has said, your cholesterol is a bit high, you better go on a statin. Well, they come to me saying, my doctor keeps insisting that I go on a statin and I don't want to. And I know a lot of my GP colleagues are very focused on the total cholesterol, which is a completely meaningless figure, and the LDL, which is not necessarily very meaningful. And I tend to follow the Paul Mason approach and have a look at what's happening with the HDL and the triglycerides, and also at the HbA1c. So if an HbA1c isn't going in the right direction, I'm all for getting people off statins. Like, why be on an unnecessary medication which actually may increase your risk of type 2 diabetes? Now, Mel, you're finished your talk. I'd like everyone to thank Mel very much.